My name is Brandon Hemphill. We're going to do a complete head-to-toe physical assessment to update your health status. If you have any questions throughout the exam, just let me know, and you have the right to refuse anything you wish. Starting out, we will inspect the skin of the face and overall expression. We will inspect and palpate the scalp and cranium. We will assess cranial nerve 2. Let me cover one eye. The chart, text roll, just read the lowest line you can.
TEPOLFDZ.
Okay, that's 2020 data. We'll do the same with this one.
TEPOLFDZ.
We got it. 2020 in both eyes. I'm going to remove your glasses for just a few minutes. We will assess temporal arteries. Good. Let me get my pen. We'll assess cranial nerves 3, 4, and 6. With your eyes only, just follow the pen, okay? Good job. We will inspect and palpate the eyebrows, eyelids, eyelashes, and eyeballs. So close your eyes for me. Okay. We will also inspect the sclera conjunctiva, the cornea, and the iris. Sclera is white. I'll pull down on your eyelid. Conjunctiva is pink. We will assess the pupil for equality, size, response to light, and regularity. You can shine the light in your eye. Pupils do constrict. We will test accommodation. At first, I want you to look at the pen, and then when I tell you to, focus on the lamp in the background, okay? So look at the pen, now the lamp in the back. Okay? All right, we will examine and inspect the nose. We'll palpate the nose. Close one nostril and sniff for me. Other one. Thank you. We will inspect and palpate the outer ears and take note of any drainage. We will do a whisper test. I will whisper a number or a word and you tell me what you hear. Close one ear for me.
Football.
Right, close the other ear.
Basketball.
Good job. Alright. We will palpate his frontal and maxillary sinus. Tell me if you feel any pain or tenderness. Good?
Good.
We'll take a look at his mouth. We will assess his teeth, his gums, buccal, mucosa, base of his mouth, palate, tongue, uvula, and pharynx. Open up for me. All teeth are present. If he had his tonsils, which my patient does not, we would grade those. We will assess cranial nerves 9 and 10. Open up and go ah. Okay. Do your gag reflex. Okay. All right. I want you to stick your tongue out and we will make sure everything is symmetrical. All right. Move your tongue. Other way. Good. All right, we will assess on his temporomandibular joints and for TMJ. Open your mouth. Close it. Open. Close it. We didn't hear any clicks, so that's great. We will palpate his preauricle, postauricle, tonsillar, submandibular, submental, superficial cervical, deep chain cervical, posterior cervical, and supraclavicular lymph nodes. Next, we will inspect and palpate the neck. We will make sure the trachea is midline. We'll feel for this thyroid. I want you to take a sip of water for me. When I say to swallow, I want you to swallow, okay? I'm just going to come around. Swallow. Fantastic. We want you to do range of motion of the neck. I want you to hyperextend it up. Now down. Put your chin to your neck. Turn it side to side. Other way. Touch your ear to your shoulder. Again. Other one. Alright. Put your chin down against my resistance. Fantastic. We will assess cranial nerves 5 and 7 when you close your eyes for me. Tell me when you feel something run across your face.
Feel it. Feel it.
Okay? You can open your eyes. I want you to smile for me. I want you to frown. I want you to blow out your cheeks. Fantastic. Alright. Alright. Next, I want you hang tight. I'm going to feel for your carotid pulses one at a time. With the Bella stethoscope, I will listen for any movements. I want you to take a deep breath and hold it for me. Okay? You can. Alright. Next, I'm going to ask you to get out of the chair and just turn the other way for me. You can scoop this out if you need some more room. We will assess the posterior and lateral chest. We will check his breathing, make sure everything is symmetrical. I'm going to put the bases of my wrist on your back, and when you feel that, say 99 for me. We're assessing for tactile primitus.
99. 99. 99. 99.
Okay. Next, we'll recurse over all lung fields. Okay. Next, we'll recurse costovertebral angle. Tell me if you feel any tenderness or pain, okay?
Mm-hmm.
Is that okay?
It's good.
Good. We'll also take breath sounds. Whenever I place the stethoscope on your back, just take a deep breath in and out for me, okay?
All right.
Okay? You can turn back around for me. Alright, next we will assess the arms, and we'll palpate each arm. Raise your sleeve up just a little. Alright, we will assess his brachial pulse, radial, and ulnar pulses. We'll do these 2 at a time. Okay? Next, we will assess tricep reflex, brachial reflex, and radial reflex. You can take your arm and hang it like this and just let it hang freely. Okay. Did it work?
Mm-hmm.
Good.
down the road.
We'll do the brachial. Cradle your arm. And the radial. Okay. Next, we'll do range of motion of the arms. Take your arms and put them up, all the way to the back. All right. Abduct them, and then adduct them. Good. Now with your forearms, flex them, extend them, hyperextend. All right. Pronate and supinate. Good. With your wrist, make a fist. Flex them, extend them, hyperextend them. Fan your fingers out, close them back. Touch each finger with your thumb. Good. Now with your eyes closed, and this is going to test cerebral function, close your eyes and then touch your nose with each finger and then do it faster each time. Hold your arms out. There you go. Good. We will assess capillary refill in each hand. Making sure it is less than 2 seconds. Good. Alright, for the next part, I'm going to ask you to lie down on the couch for me, okay? To respect my patient's privacy, he does wish to keep his clothing on. Normally we would inspect all of the chest. We would palpate it for any lumps, any masses, especially around the breast area. We would assess PMI for any pulsations, thrills, tease. I will raise your shirt up just a little. We would feel for that. Okay. Which with his body type, you can't notice anything, but I can feel a fold. I will auscultate his heart sounds with the bell and the diaphragm. We would use the diaphragm for heart sounds, the bell for murmurs. We'll listen to his aortic, ulmonic, mitral, and tricuspid. Right, no murmurs were detected. Everything sounds great. I'm going to raise your shoulder up just a little to assess your abdomen. We would inspect the abdomen and the umbilicus for any hernias, protrusions. We would assess for contour. Everything looks great. We will auscultate each of the quadrants for vital sounds. We will auscultate the aorta and bilateral renal arteries. Right, next, we will recurse each of the 4 quadrants. Right. And while he is lying there, we would assess his work of breathing, make sure respirations are even and unlabored. Raise your shirt up just a little bit. Recurse. Okay. Next, we'll use light palpation. Let me know if you experience any pain or tenderness, okay? Alright, and then we will use deep palpation. Does everything feel okay? You're good. Next, we will palpate the liver. I'm just going to slide my hand back here. And with this patient in particular, we could not palpate his liver, which is okay. Next, we will inspect and palpate both legs. We would assess his popliteal, posterior tibial, and dorsalis pedis pulses. Okay. We will assess for a babinski reflex. I will take a pin and run it up your foot. Good. Next, we will assess range of motion of the legs. So one leg at a time, take it up as high as you can, up to 90 degrees. Okay? The other leg. Okay? Take both kneecaps and turn them inward. Yes, and then outward. Good. Bring your knees to your chest and back. All right. Flex your foot upward, downward. Put them in, inward. Toes go in. Yep, and then out. All right, then against resistance, push up, push down. Good. And we will assess calf refill on the toes. Right. We would assess for any edema in his lower extremities. All right, next, another cerebral function test we can do is run your heel down your shin. Good. All right, I'm going to get you back up in the chair. All right. Another thing that we were supposed to have done earlier is turn your head against my hand. All right, let me see your hands. Push against me. Now pull me. Good. Next, we'll assess his patellar and Achilles reflex. Just hang your legs down for me. Good. 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 All right, I'm going to ask you to stand up for me. I want you to walk on your heels like this. Either way. Walk on your heels. Good. I don't know if that was on camera. We will shift the camera down just so they can see. All right, do it again. On your heels. Good. Now walk on your toes. All right, now we're going to do a Romberg test. Just close your eyes for me and stand still. All right, you can open them. Now hop on one leg, back and forth. Now the other leg. Good. Now we're going to assess your spine. Normally, if the shirt was off, we could inspect it. We will palpate the spine. Show your shoulders. We'll assess spinal accessory. Tilt from side to side. Twist. Good. Lean back. Now bend over and touch your toes. Good. Alright, take one more seat for me. Alright, what we're going to do now is test rapophagia and steroidinosis. I want you to close your eyes. I'm going to draw a number in each hand, and you tell me what number that is, okay? So what number is this?
3.
Good job. We'll do the other one.
2.
Yes. Alright. Next, I will put a common object in your hand. I want you to close your eyes and tell me what that object is. What is that?
That is a key.
Correct. Alright, and the other hand? What is that?
It's a coin.
Correct. Alright. I believe that concludes this assessment. Thank you for your time.
Thank you.